right, if that is Christmas at your house, then you definitely need to stick around for this segment. We've all been there, those crazy holiday family get-togethers. So today, this morning for our Healthy Living House Calls, we're going to take a look at dealing with your mental health and all that stress that surrounds the holidays. And joining me this morning is Dr. Jason Salagubang. He's a family medicine and geriatric specialist at Florida Hospital of Hopkins. Thanks so much for coming in. It's such a pleasure to see you.
Yes, thank you.
All right, so we see these scenes from movies like Christmas Vacation, and we think, that's exactly how Christmas is at my house. Isn't it sad? But it's true, because I guess there's something about the holidays that bring out the chaos.
That is true. You know, around the holiday season, it can be a good thing. Usually, we want it to be a great thing for our loved ones when we get together. But even for some people, it can bring up some intense emotions, especially if you're experiencing the loss of a loved one. So, you know, we want it to be a positive experience, but for some people, it can be a negative one, too, as well.
Do we often place too much pressure on ourselves to try to create the perfect holiday? And in the end, I think sometimes we're almost setting ourselves up for disaster.
What I could tell you, especially what I've seen in my practice and with the economic downturn, a lot of people will come into my practice with vague complaints of abdominal pain, chest pain, shortness of breath. But when you get to the heart of the matter, they're going through some type of emotional distress. And it's important to remember, if you consider yourself part of the human race, part of our overall well-being has to deal with a physical component, emotional, and even a spiritual component. And when one of those things is out of whack, so to speak, it affects everything else too as well.
So how do we sort of find that balance as we're going in? What do you tell your patients who are like, I'm so stressed out, doctor, I don't even know, where to begin? Because there is a lot to accomplish, and I think sometimes women tend to internalize all of those accomplishments even more so than men.
Yeah. Well, I refer people to one of the oldest documents ever written. And there's this proverb that says, a merry heart does good like medicine, but a broken spirit dries the bones. That's found in Proverbs 17, verse 22. And what it's talking about is that interplay between physical, emotional, and spiritual. And some things you can do, some basic things that don't require a lot of money, is making sure you're exercising enough, drinking plenty of water, eating plenty of fruits and vegetables, engaging yourself in positive emotional activities. I'm not just talking about in front of the TV, you know, with your Xbox, but something that can stimulate your mind. And then, of course, getting deep into your spiritual aspect, whether that's prayer, meditation, or communing with nature.
And sadly, a lot of people, too, go into the holidays with elderly relatives, and you know, maybe they haven't seen grandma in a year, and they start to see the decline that they didn't notice the year before. That's something you probably see a lot of as well. Yeah,
I deal a lot with elderly patients. I have some extra training in geriatrics, and one of the unfortunately, the biggest things I see is dementia. But you'll be surprised, even with these demented folks, they may not remember something that happened last week, but once you start playing those Christmas carols, they'll be singing their heart out. So it can actually be a positive thing. So I think if people and family members can focus on the positive memories, that certainly can help them cope with the stresses with the holiday season.
All right, Dr. Jason Salagubang, thank you so much. So nice meeting you from Florida Hospital. And if you have any questions for him, he's going to be here in our web center for the rest of the morning answering your questions. All you have to do is go to our website, myfoxorlando.com. Just click on top stories and then join the web chat. I know you have a lot of questions, so go ahead, ask away. You're ready, right? All right, Jim, let's send it over to you.
Good stuff, Amy. A good segment. Of course, we definitely want some happy holidays out there.
Don't forget, Dr. Salagubang is on the web right now answering all of your questions this morning about your mental health over the holidays. He's here from Florida Hospital. We're so glad he's here. All you have to do is log on to myfoxorlando.com and then click on Top Stories to join the web chat. It's now 9:28. You're watching Good Day. Welcome back, 9:44. The doctor is in, and all morning long, Dr. Jason Salagubang has been answering your questions about mental health issues, and he's here with us now, and you've been blogging here, and you've been getting some good questions. What kind of questions have you been getting?
I've been getting some great questions, such as, do traumatic events contribute to mental health problems? And they can, especially if it interferes with your ability to function. Some other questions included things like, what can I do for my loved one who has dementia? What kind of things can I do just to make the holiday holidays seem seamless. And the biggest thing I can kind of tell you is with our demented patients, it's important that they maintain a routine. Try not to take them out of the ordinary, because if you put them in a situation where they're not familiar with, that can increase their agitation, it can increase behavioral problems, and that can be a very stressful event. So, you know, keeping meal times, snack times, activity times, medication times, and bed times consistent will be helpful for those demented patients. So,
and a lot of people, I think, this time of year, you know, if they do start getting what we call like seasonal affective disorder, or they become a little maybe more blue because of the season, how do you sort of know the difference between that and actual clinical depression?
Well, with seasonal affective disorder, it'd probably be pretty rare to get it here in Florida because we have so much sunlight. When the depression becomes really an issue is when it starts to interfere with your ability to function, with your ability to work, interact with others. We're all going to go through stress. That's just a fact of life. We're all going to go through hard times. We're all going to experience loss. But being able to find a way to find a pressure relief valve, whether that's running a couple miles or meditating or just hanging out with your loved ones, we got to find a way just to release that pressure.
And I would say you would probably suggest limiting alcohol too, because a lot of people think, oh, it's the holidays, I'm going to drink, and that's not always such a good idea.
Yeah, I hear a lot of times people talk about alcohol in moderation, but your idea of moderation might be different. What I think is moderation. For example, our elderly folk, they really should be drinking no more than one alcoholic drink every 2 or so days.
Oh, wow.
You know, and that's considered being moderate. And if you're wanting to get the health effects of alcohol, there are other things you can do, such as eating a diet full of antioxidants with grapes and with cherries and with oranges. So yes, alcohol moderation, my definition, is important, especially during the holidays.
And no fruitcake. That's my advice, okay? I hate fruitcake. All right, thank you so much, Dr. Jason Salagubang. It was such a pleasure having you in this morning, and thank you so much. And you can still blog with him for a few more minutes. If you have questions, go ahead and go to the website and ask away, because he's going to be here for a few more minutes. Michelle, Jim, let's send it back to you.